deep apologies, but it's lovely to have you, and we're very excited to have you.
Thank you, no problem.
Okay, great. Okay, we're gonna go ahead. I'm gonna call this meeting to order. Let's start off as we with the land acknowledgement. Pete.
Okay, can you see that there?
Yes.
Perfect. The San Francisco Health Commission, San Francisco Department of Public Health staff acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all people who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples.
Thank you. Okay, we are doing roll call behind the scene. I think we are short one, but we should have everyone soon. Eric, are we still short?
We are still short one person.
Okay. We're going to go ahead and continue to roll on. I'm going to make some adjustments to the agenda. Again, we would like to move up item number 6, which is CalFresh delays and changes, planning and response. So we have either Susie Smith or Cindy from HSA to present. Hi, Susie. Welcome, welcome. And to the next item, and then after that, we will move into the next piece, which is the approval of minutes. So, any public comment on item number 3, welcome and roll call introductions? Great, and we are at quorum. Thank you. Wonderful. So, want to take a moment to thank the HSA team for their heroic efforts behind the scenes. Everybody here, we're all feeling it. This is a horrible situation for our folks. As we know, SNAP, CalFresh is a major lifeline. We know that it doesn't last the whole month, even as it is whole, let alone folks having to deal with the uncertainty of where their food is coming from, how to feed their families, worried about their neighbors. So I know we're all in this response together, but I want to give a little moment to acknowledge how difficult this situation is and how hard it's been for everyone. And really want to thank the work of the HSA team trying to mitigate this situation as much as possible. And we'll have more time again to talk about everyone's response and currently what's happening. But want to start off with Susie. Did you want to start off with the updates on where we are with the November benefits and emergency card?
Yes, thank you all, and thank you for acknowledging how difficult a time this is right now for the families and the folks that we serve here in the city. So I can briefly give an update on the federal the lawsuit and the administration's response, which I'm sure folks have been following in the news. The administration will be issuing partial benefits for November. The statewide data system that administers the benefits, CalSAWS, needs to be updated and programmed because it's only partial benefits. And so our understanding is that that's going to take a few weeks to finish. And so it may not be until towards the end of the month or even December until folks get their partial November benefits. So that is why we have been, working really hard in partnership with many of you and the food bank and others to develop our CalFresh emergency grocery program. And I actually thought, Sissy, I'll have Fiona share a few slides. We developed a toolkit for CBO partners, and I think it might be helpful just to go over a few of those slides. And then we'll also put in the link in the chat, a link to this toolkit, as well as FAQ and other materials that we've developed, which I sent out yesterday. Yeah, let's go to the second slide. So as I mentioned, this is our response and to the delay in CalFresh benefits. Communities across the country are responding. In our case, we wanted to be very specific in terms of really making sure the people on CalFresh are the ones to access additional support. And we wanted to try to mimic as much as we could the way people typically get benefits through their EBT. And so we were so thrilled that Crankstart stepped up in identifying $9 million, and the city, the mayor and the board also identified $9 million from the city's emergency federal response fund to be able to have $18 million to provide a one-time prepaid grocery card for those who were CalFresh recipients. We're doing this in partnership with a really amazing partner named GiveCard. They're a financial technology company, and they help governments and organizations disperse funds rapidly in emergency type situations. They helped with the LA fires as well as with the Texas floods. And the card, essentially, it's a prepaid debit card, which can be used virtually, or you can get a physical card. It allows people to purchase groceries and meals at nearly all of the same places that accept EBT, but it's not an EBT card. It's not a replacement EBT. It's separate one-time supplement, and it doesn't have the functions of a bank card. There's no withdrawals. You can't deposit or transfer accounts. And as is with EBT, you are not allowed to purchase sugary or alcoholic beverages or tobacco using this card. So we really need your partnership and depend on you all to help get the word out about this new benefit for folks. I will like to say, just in terms of a little bit of exciting news, I mean, it's already working to some extent. We mailed out 82,000 letters on Monday at 6 p.m. that they were sent. The mailroom worked over the weekend, translated, of course, into threshold languages. And as of yesterday, Tuesday, end of day, when most people hadn't even received their letters, we got 6,200 CalFresh recipients. So over 7.6% of folks receiving the letter have already activated claims, the funding and the cards on day one. So it just speaks to the demand and how much our families and community members need this support. And I think the other stat I'll just share with you from our first day of this activation is that 96% of those who claimed the card were able to do so themselves, actually without the assistance of community. So really great statistic in terms of the accessibility of the card and the ease, sort of the customer-friendly ease in which people can navigate how to activate their funds. So in terms of support that we need from you all, it's really spreading the word. Our message is for clients to check their mail and to know that the quickest way to get the funds is by activating the card virtually and downloading it like you would Google Pay or Apple Pay. But also, to help assisting clients who do need that support in claiming their grocery card. For more complex questions about the eligibility and card access, refer them to us, and then we have the information on our GiveCard partner as well for more functionality questions. So together, we're going to get this card in the hands of every CalFresh San Franciscan that needs the support. And so I'll go through a few more details that might be helpful for your folks, and then I can take some questions. How to use the card. So again, it's a virtual card. You input when you get the letter, it has a specific alphanumerical code that you input. And you then download the card, you input the details to order groceries online, just like you would a regular debit card. You can add it, as I mentioned, to your smartphone. It enables tap to pay. Alternatively, for those for whom navigating a virtual card is just too much, there's an option to click to get a physical card. And then once you get it, it can be used like a debit card in any in-person locations or used online to place grocery orders. Again, in terms of the delay of virtual versus a physical card, it'll take about a week to get the physical card. And then just another note that the virtual and physical cards are linked to the same account, so any purchases on one will automatically update the other. Okay, so this is, yeah, so so I mentioned they got the letters this week. They must claim the card by the end of the calendar year, so by December 31st, and then they must use the funds on the card by March 31st. As I mentioned last week in our call, the amount that people will get on their card varies according to their household size. It's not an exact match to what they receive in CalFresh, but they're based on the average benefit amount for different household size. So we have those here. And then I know last time folks were asking, can they see an example of what the client letter looks like? So here's just sort of a screenshot of you know, what it looks like. We're not doing the whole letter. We don't want to, we want to be careful about fraud and all of this. So we're being a little bit careful in terms of like how much we're publicly sharing, but this just gives you a feel for, you know, what the letter will look like and what the action that clients, community members need to take in order to activate their card. I know this question came up last week, you know, is this going to impact my eligibility for other benefits? Will it impact my eligibility for CalFresh? And the answer is definitively no. This will have no impact on any other benefits that they're receiving through San Francisco Human Services Agency, at least. So that, you know, important note for clients not to worry about that. And then I also mentioned last time that for clients who use the general delivery as their mailing address of record for CalFresh or have post office boxes, they will have an option to pick up their cards in person at HSA starting tomorrow. And we actually are bifurcating this a little bit, where we're having single adults go to 1235 Mission. Also, Code Tenderloin is partnering with us, so very graciously are opening up 6 of their windows to be able to help with that. We expect a lot of people and to help expand our capacity. For families, we're recommending they come to 170 Otis. That is typically, yes. The slides are in actually in the chat. We have a link to the CBO toolkit, and that's where all these slides are coming from. Thanks for the question, Chester. So yeah, we know that you know, there's going to be a lot of demand. People will probably expect long lines and wait times tomorrow. People will still need to verify, you know, their identity. And then I think that is probably it. I think this is then getting into a level of detail that we probably don't need for this particular audience, but just wanted to give you a feel for what we've included in the training. You know, there's another 8 slides or so that go through more details and have screenshots of what it looks like when community members navigate the site. So that is our big update. I think the other piece that I wanted to mention is just our community engagement strategy, which I think is really important to make sure community knows about this and these tools. So we have been well, first 311 knows. So that's another resource that if people call 311, they are getting this information as well and know how to help people navigate their cards. But in terms of community, we have reached out to the Latino Task Force, the San Francisco African American Faith-Based Community, the API Council. We've reached out to all of the FRCs who are partnering with us to help families get access to this resource, as well as the Aging and Disability Resource Centers, ADRCs. So again, can help seniors, people with disabilities navigate and order a physical card if that makes the most sense for them. All of our grantees within Cindy Lynn and his portfolio, the Citywide Food Access Team, CFAT grantees, also reached out to ASA and DPH, and they are setting up some trainings for us. HSH, we have a whole sort of strategy for people who are experiencing homelessness and having shelters and permanent supportive housing sites assist people in activating their cards, and then helping people come, you know, letting them know for people with general delivery mailboxes, they can come to us. Also important to note, even if someone has general delivery mailbox, they could call and have they could have the card sent to them or sent to another address if they want. There's a way to kind of, call with your identity that we would ask for normally when you're calling to say, yes, this is me. And, we can assist them that way as well. Also, we're reaching out to the school district, hoping to get a blurb in the letter that goes out to all parents and families. So doing a pretty extensive, OSEA, HRC, DCOF, all of our sort of MOHCD, all of our sister partners kind of doing as wide a net in terms of letting people know about the resource, how to access it. And for those that want to help people access the cards, they can get the toolkit and we can do individual trainings as well, which is what we've been doing. So a huge thanks, I just say, to not only folks on this call, but the people behind the scenes that have been working day in and day out to try to get this off the ground. Members of my team, but then also folks across other entities. So thank you all. Happy to answer any questions.
Great.
And I see Cindy Lynn is now on. If I've missed anything, feel free to pop in. My co-conspirator.
No, you got it all.
Katie.
Yes, I'm sorry, Susie. I missed when you said that. What percentage of the people have activated their cards?
7%. So in
7%.
day one, which we mailed,
Right.
let's just be clear, like it was put in the mail at 6 p.m. Monday. And by the end of Tuesday, most people wouldn't have received necessarily the letters. By the end of Tuesday, we already had, about 6,200.
Great.
Don't
And
share
just-
with the media yet, because we might want to be excited.
I
Excitedly
was just
sharing.
curious here, but also just appreciative. I, can imagine what an amount of work that has been for you all, and it does have a huge impact. So, thank you.
Thanks, Katie.
Oh, and I did have one other question, just in terms of looking forward. I know December is like we're getting through this one, but is there any plans to have any conversations around December, like pre-planning or anything like that?
We will know by the 23rd of this month whether or not that's kind of the deadline for when there needs to be federal action in order to continue in terms of shutdown action, in order to continue the December benefits without any disruption. So we're going to have to we're basically just going to have to monitor it closely. We're hopefully going to get some more clarity over the next couple weeks. And we can keep you. It's the 5th. I think this has been a big pressure point for the administration and Congress to actually act and shut this down, shut the shutdown down. So, we'll keep in touch, but we know that 23rd deadline is an important one in order to get the December issuance out on time.
Susie, I'm going to echo on that. And first of all, just want to echo, like, incredible. Also, thank you so much for getting this out across all of the city departments. So we're all speaking the same. And I did have a question about how, I know that you've said that disseminating clearly the information that you have given, so it's really clear, so people aren't getting different sets of information. Is there anything else we as a body can do to help?
I think actually, Sissy, the point you just raised is a good one, that sometimes people take information and they create their own flyers, and we're really trying to give community what you need so that, like, it's a complex program in a very short period of time. You want to make sure that you're using the materials that we have available. And if there's something that you need that we don't have, reach out. But really, I think the message is check your mail. The quickest way to get the card is virtually. We're here to help if you need help. And if you don't, I guess the other piece, that if they don't get their cards by November 10th, then contact us, because then, we're going to need to do some troubleshooting and figuring out why they didn't get their cards.
Right.
But for now, and also just to convey, it's not a scam. Like, we are worried that people will think it's a scam. you know, people should not share their social security numbers, their bank account numbers, any of that. You know, the only thing they need to activate the card is that number, the unique number they're going to get, and their date of birth.
Is there any other talking points you recommend? And I know this is so frustrating because you guys have done amazing work to get this out in such a short time frame. And here we are asking you about like December already, but it's because our participants are already, as you know, because you know, you guys are dealing with this as well as everyone else. But people are already worried about it. They're already trying to, you know, our wait lists are trying to get into other parts to make sure they have food coming. What is the recommendation for our talking points for participants, but also like you know, it's hard. There's a lot of ramping up for the CBOs across the line because people are already at their doors. What is the recommended thing to say, and how do you recommend us as we approach our planning?
Yeah, I mean, I think a few things I would say. One, I know the food bank is ramping up additional resource as well, knowing the demand. And I don't know if we have someone from the food bank on today, but maybe they can give an update about some of what they're doing in response. Where we can and where the CFAC grantees had capacity, we're flexing using contingency funding as well to kind of help with immediate additional demand that, you know, that could bleed into December. And I mean, it's advocacy, right? It's like, I think all the news and the lawsuit and the profiles, I mean, it's really advocacy to like, we're not going to be, it's $20 million a month that is issued in CalFresh benefits in San Francisco. Obviously, we're not going to sustain this, like doing an alternative programming. So we really need to advocate that the government reopens. And if you've got friends in other states where congressionally could be more impactful, you know, get the people to call their own representatives, right? We're in a food crisis.
Yeah, I just want to emphasize how not to fall into that gap of that playing field, because the playing field was like SNAP did not cover it already, right?
Yeah.
SNAP was already too small to, you know, people relied on other resources. So that, you know, bulking up the food system has to happen across, you know, just to make basic needs anyway. So this is just a crisis that we really appreciate you stepping up for.
And we don't want to be like, oh, federal government, it's okay. Like private philanthropy and local governments will step in when you don't do your job. Like, right.
Sissy, if you'd like, I can give an update on what the interventions we've done to support the need. And
yeah, let's wait a second because I know that Susie and Cindy are popping off or have to go at 2:00. So I wanted to make sure that there's any other food security task force members I know.
Can I just add something to your last question and what Susie shared, Sissy?
Yeah.
I know that we have a population in San Francisco that might rely on meals more than groceries. And of course, this impacts them as well. Just want to say that we are supporting Glide with additional capacity to add 650 meals per day in addition to what they were doing at their dining room. So that's a resource that, you know, again, for those who need meal support rather than grocery support generally, that's a good place to send them.
Great, thank you. It's really helpful. Okay, any other comments, questions before this team has to, or some of the team has to roll off? Okay, so thank you guys so much. We are happy to, if we need to do another emergency food meeting around the December, if there's issues around that, we're happy to do that. But we'll keep in touch, and thank you so much for this tremendous work, and let us know what we can do and we'll get it out through our networks.
Well, thank you for the collaboration. This
Thank
really has
you.
been a collaboration among some great organizations, including the Food Bank. And Sissy, you've been a great thought partner and stepping up as well. So just really appreciate everybody. I know community is really in need, and it's, you know, it's in these moments that we come together and to support each other and the community, you know, as best we can.
Super. All right, thank you all. So Noriko,
Yeah, so we are in the middle and have stood up a couple of intervention programs. So the first one is we did do an inquiry with our grocery network and our partners to see if there can be an increase in capacity in the different pantries. And we've expanded the home delivery grocery program to open it up to more individuals who would like to receive those home delivery groceries to their door because of also the ICE enforcement impacts that are happening in our community as well. Additionally, we are offering partner and non-partner agencies to pick up grocery bags at the food bank. And so if you would like to inquire, have more questions about it, I'm more than happy to talk and also drop a link in the chat if your agency would like to do grocery bag pickups at the food bank.
Super. Thank you. Let's go ahead and open it up to other folks. Planning and response. Hannah.
Hi, yes. So at Meals on Wheels, we've actually secured private funding to create emergency food boxes for our clients. We're thinking a little bit longer term, what happens if they're not able to access their card for whatever reason, or if the shutdown extends through December. So we're very fortunate to be able to secure that, and we're working on getting those out in the next week, 2 weeks.
Great. Wonderful.
Yeah, we at Project Open Hand are doing something similar for our folks who, again, we were kind of anticipating that there would be some delays and, some folks that didn't get cards or whatever. So we'll be doing something similar here, and then planning and thinking towards December in the event. That's still an issue. Hopefully it won't be.
Other folks want to share their planning. Jennifer, I don't know if you're Labar. Are you willing to? I know you spoke last week.
Sure. We have notified and well, let me say this. We have reminded all of our families that breakfast and lunch continues to be served at no charge in all of our schools. So letting them know that that is a resource. We also worked with our after school programs where they're serving supper to make sure that they know that they should be welcoming any child who is, it gets a little complicated, but essentially if you're enrolled in our schools, you're welcome. If you're 19 years and younger, you're welcome. And if you are part of our special ed community, 22 years and younger, you're welcome to have free supper at whatever schools are offering that. And we've posted those lists up. I haven't really seen an uptick in meals, but it's just Wednesday. So, I think, it takes a little bit of time for word to get out, but our after school programs were very happy to do this and understanding and willing and able. And a few of them had already reached out to us asking for increase in meals so that they are able to do so. And that's what we have going on right now. We're not sure if we're going to be able to do more, but this is what we can do within the confines of our current funding.
Great. Thank you.
Yeah, you're welcome.
Katie.
Yeah, just a question. And I know most and almost everyone on this call is mostly San Francisco, but if anyone has any information about Alameda response besides just the allocation to food banks, I would love to know what anyone else knows.
Yeah, I mean, it's horrible. Yeah, other counties are really just they're super scrambling. Okay, I'm gonna ask Jamil if I know that this question has just come up, so I just wanted to say there are other questions that are coming up around CalFresh around the other changes that were anticipated, the able-bodied. Obviously there's this shutdown, but it's making everyone really nervous about all of the other potential changes. Is there any updates on that?
Yeah, we received or states have received a couple of memos from FNS about the implementation dates for the new ABOD criteria and the new non-citizen criteria. But we're still waiting for CDSS to gather the details. So there's no like official state implementation date that's been communicated to the counties. So counties are just kind of in this wait for additional guidance from the state mode. And we're still waiting for our systems to be updated to, be coded to the new rules. So all of that says, counties are still waiting for additional guidance from CDSS. But we're preparing material to like train our staff, as soon as, we get the word that, it needs to be implemented on this specific date. What the feds have communicated to states is that any sort of like hold harmless period that states would have been under for, not implementing the HR1 changes yet is over. That expired on November 2nd. But yeah, that's all we have in terms of like any clear cut dates, because CDSS again have to work out many details and give that guidance to the counties. So
Okay, yeah.
yeah. So that's where we are now. I mean, we're keeping an eye. My team is keeping, a close eye on it. But just that's where we stand at this point with those
Okay.
changes.
Yeah, and so if there's cuts to California, that would come down, like, is there any other potential risk for cuts that we should be aware of? You know what I'm saying?
Yeah, I mean, I think once the ABOT changes kick in, there's going to be a whole bunch of people that are going to need to meet the work requirement now. The earliest those cuts could happen would be at the end of March. So starting April, people will start to feel if you're not meeting a work requirement, that's when folks start have an exemption. That's when people will start to be discontinued from the program.
Okay, great. And we'll be able to get some numbers at some point about who that might impact.
Yeah, I've reached out to our planning team, so we'll if we're able to share, so if I'm able to share something here, we'll definitely provide that.
Yeah. Okay, great. Thank you, Jamil. And again, thank you for your tremendous work there. It's insane. So thank you for that.
Yeah.
Michelle.
Hi, Sissy. Sorry, I couldn't raise my hand on my phone, so I had to run over here. I just got back late from the doctor's appointment. But so DCYF, we want to be intentional with our support. So we released a survey for our DCYF grantees to see what support that they would need. So one is we can provide extra meals to program participants and their families. So it doesn't necessarily have to be youth enrolled in the program, but their families enrolled in the program. So we're trying to figure out how many meals that would be and when's the earliest they can help distribute those meals. The second option we are also looking into is providing weekend meals, shelf-stable meals that the families can pick up on a Friday that will last them throughout the weekend. So we're surveying our CBOs to see who might be able to do that, because we are relying on our CBOs to help with that support. So once we get all the information in, I could probably send a better update in terms of all the numbers, but that is what we are working on.
Okay. Great, thank you. Great. Other folks, Food Security Task Force, before I open it up to questions, comments, planning, before I open it up to the general public. Okay, let's open it up for public comment. Okay. I am currently not seeing any hands up, and I'm not seeing any comments in the chat. So thank you all. Oh, sorry. Go ahead.
Hi,
Linda.
good afternoon,
Hi.
everyone. My name is Linda. I'm from Homeless Prenatal Program, and I just wanted to say thank you to everybody for, being on, as a community together. And I just want to also say that we are doing everything possible to support our families with um, updating their gift cards. So hopefully that within the next couple of days, you'll see an increase in participation with that.
Great. Thank you. Thank you. Anyone else? Great, thank you. I know that there's just a lot of activity going on at every level around this, so really appreciate everyone getting together on this. Amazing. Okay, so let's go to our next item. Again, we brought this item. This is item 6 that we brought into item 4. So we need to get back to number 4, approval of minutes. So let's go through this pretty quickly.
Okay, so we are checking 2 minutes today. We are checking October 1st and October 29th, the special meeting. So I'll start with October 1st. Can you see my screen here, Sissy?
Yep, all set. Okay, and these minutes have been posted on the website and had the opportunity to be reviewed by task force members.
Yes.
Okay, any changes, corrections for the set of the October 1st task force meeting? I'm hearing none, seeing none. Do we have a motion to pass these minutes without corrections as is?
This is Reagan. I move to approve the minutes as is.
Great. Do I have a second?
I'll second. This is Hannah.
Great, Hannah, second. All in favor, please raise your hand. Is Eric, you taking count?
Yeah,
Okay,
I
great.
have 12 approved.
Okay, great. Could you lower hands, please? And then any abstentions? Seeing none in the chat. Oh, one, J-Mel abstains. Any nays? Okay, I'm seeing none. Thank you. The minutes have been approved as is. Can we see the next set, P? Thank you.
Okay, these are from October 29th, special meeting.
Super. Okay, any changes, corrections? Not seeing any hands up, not seeing anything in the chat. Okay, would anyone like to move to approve these minutes as is?
Motion to approve minutes.
Great, thank you, Chester. Do I have a second?
This is Jennifer, I second.
Jennifer, second. Okay, all in favor, please raise your hand.
I have 9 votes.
Okay. Any abstentions? Jamil abstains. And Reagan abstains. iPhone abstains. Who's that?
I think that's Marion.
Yes.
Oh, great, Mary. Gotcha. Okay. Thank you. Any nays? Okay. Thank you. That passed, right, Eric?
Yes.
Thank you. Okay, wonderful. Let's move on to any public comment on the approval of minutes. Great. I'm not seeing any hands up, and I'm not seeing anything in the chat. Okay, we'll move on to the next item. Again, we have general public comment. We usually bring this at the beginning of the meeting. So this is just open for anyone who wants to give general public comment. I am not seeing any hands up, and I'm not seeing any notes in the chat. So I think we can move on to, that was item number 5. Again, item number 6, we have already done. We are moving on to item number 7, which is the homelessness and supportive housing updates. And this is Lisa. Are you here, Lisa?
Yeah, I'm here.
Wonderful. Thank you so much for presenting for us today.
Yeah, glad to be here. Can you remind me how much time I have? Just so I can make sure to stay within.
Yeah, you're fine. We're ahead of schedule, so I think you're fine. Right now, you had 20 minutes.
Okay,
Wait, 20,
perfect.
30. Oh, no. Yeah, you got plenty of time.
Okay, sounds good. Well, I can go ahead and start by introducing myself. My name's Lisa Rakowitz, and I'm from the Department of Homelessness and Supportive Housing. I use she, her pronouns, and my position at HSH is the Director of Outreach and Shelter Services. Thanks for inviting me to join the task force today. I'm going to be walking through HSH's services that make up the homeless response system, and then focus a bit on how HSH is funding food services in our programs. I have a few slides at the beginning that I'm going to probably walk through kind of quickly. Really just this particular slide is just starting off to show some numbers to help explain the scope of the homelessness crisis in San Francisco. I know many of you are experts in this area, so I'm not going to spend too much time on it, but I just wanted to include this in the slides for reference for folks. Every 2 years, HSH is required by the federal government to do a point-in-time count, and that's really where a lot of this data that you see on this slide is coming from. It's essentially a census of people living unsheltered on the streets of San Francisco and people that are in our shelter system. But again, it's really a point in time count, meaning it's data that's taken on a single night in San Francisco. But as you can see in 2024, for our total homeless, we had about 8,000 folks who were counted as experiencing homelessness that night, with a little over half of them being unsheltered. And you can see it's broken down a little bit farther into youth and family. I also just wanted to note that, in 2024, we saw a small increase, 7% of folks experiencing homelessness. And I also just wanted to highlight, we have an increase of folks who are sheltered. And I think really that's attributed to a lot of additional shelter capacity that HSH has stood up in the last few years. We've been working really hard to bring more shelter beds online, so we're seeing a bigger portion of the population in shelter versus unsheltered. Okay, next slide. Again, I'm not going to dwell too much on this, but just for reference for you to know, we really at HSH use the federal definition of homelessness. And then in addition, we have kind of broadened that definition to include families who are doubled up or living in single room occupancy units. Next slide. This is also just a quick slide really to highlight the system inequities and that we see across our system. There's been decades of disinvestment in housing and ever-increasing costs of housing, which disproportionately impacts people of color, making homelessness a racial justice issue. And you can see that play out in some of this data. Next slide. Our department launched in 2016, and I think really one thing to highlight is we serve over 15,000 people every day throughout our homeless response system. Next slide. Again, this one's more just for reference about our department and the work we do. We have a number of oversight committees, and there's some information on this slide and on our website about these committees. And then in the next slide, it also highlights just what our strategic plan goals are for the department, what we're really trying to do over a 5-year period to try to reduce homelessness, reduce racial inequities, increase the number of people exiting homelessness, supporting people to succeed in housing, and then trying to prevent homelessness. And there's a lot of information on our website if you want to dive more into that. Next, really going to focus on each individual core component we have in the homeless response system. You can see these are in these boxes, these are the main components: homeless prevention, coordinated entry, outreach, shelter, housing problem solving, and housing. And I'm going to go through each one in a little bit of information. The first core component is outreach. Our outreach team works to connect people living outside with the rest of the homeless response system. This is primarily done through a contract that HSH has with the nonprofit Haluna Health, which staffs the San Francisco Homeless Outreach Team, also known as SF HOT. And you can see in the slide, it talks a little bit about what SF HOT is doing, really trying to engage and stabilize people on the street who are experiencing homelessness, build trust and relationships, provide resources and supplies, case management, and they also do coordinated entry assessments because they are an access partner. So they provide those services as well in their work every day. They work in small teams 7 days a week as part of the city's neighborhood street teams collaboration. So you may have heard that over the last year, the city has really worked to organize all of the street teams that are in various different departments to come together and do more coordination and collaboration to ensure more effective outreach. And it's really divided up in different by neighborhood in the city. So it's really allowed HSH and our outreach teams to collaborate more closely and coordinated with the Department of Public Health and other departments, fire, various folks that are out on the street engaging with people. And just for scope, you can see some data about our outreach engagements over the last 12 months. Okay. The next one I'll point to is homeless prevention. This really includes strategies to prevent or to rapidly end someone's homelessness without needing to provide longer-term support from the homeless response system. And this is a big area that we're trying to expand at HSH. It can include, as it says on the slide, there's flexible financial assistance, and then engagement with partner systems are some of the things that we're really focused on. Okay, let's go to the next one, coordinated entry. That's another big component of our system. We often call it CE. CE is really a streamlined process that we use to try to match the clients we're working with to housing and to other resources. to try to end their homelessness crisis. And really this is the front door of the homelessness response system. People can come to a location, an access point location to get services. And then we also partner with a number of other folks in our system, like the Department of Public Health and the Homeless Outreach Team, who are what we call access partners. And they, as part of their regular services, will perform some of the coordinated entry work. Next slide. I wanted to just show this graphic and mention quickly one of the things that's happening in the coordinated entry process is that folks are having conversations about how to resolve their homelessness, often called problem-solving conversations. And they're also getting a coordinated entry assessment, so a housing assessment. Those are some of the core things that are happening when someone first comes to an access point. And just wanted to highlight that the coordinated entry assessment is really scoring folks based on their vulnerability, length of time homelessness, and their barriers to housing to really determine what their score is. And HSH categorizes our housing in that for folks who have the highest vulnerability, the highest scores, they are the ones that are eligible for housing, the housing that we have, the permanent supportive housing services that have the most support in our system. So we're really trying to target people with the highest needs with our services that have the most support through this coordinated entry assessment. The next slide just really talks about how many access points we have around the city. They're divided by population. We have adult, family, youth, and we also there's some DV access points services. We also have some mobile teams around the city that can go out and assess people where they're at. We do this a lot with our shelter system, for example. And a lot more information, really just want to keep pointing to our website. We have a lot of information on our website about all of these services. And then next is housing problem solving. So this is something that occurs at the coordinated entry access points. And then we also provide some problem solving services at our family shelters. These are really interventions that are trying to divert or rapidly exit households from homelessness by supporting them through a creative conversation to explore their options and resources. So some of the strategies that we really use is housing location assistance to help people navigate the rental market, travel and relocation assistance to reunite with support systems elsewhere outside of the city. We also do some reunification, mediation, and conflict resolution, and then some flexible financial assistance to cover specific costs to get people into a safe indoor place, such as money to purchase a bed or grocery cards to use while staying with a family member who can't cover food costs. All right, and then the next component is shelter. Shelter provides temporary places for people to stay while they're seeking housing and other services. Really, shelter, we kind of talk about it as an umbrella category for many different kinds of programs. We have our emergency shelter system is divided into what we call congregate shelters. So programs that have shared spaces like dorm spaces or rooms where people are sharing the space. We have non-congregate shelters, so really shelters that are have private units. We do that in either hotel facilities, or we've also have some programs where we have private cabins. And you can see the photo here. This is actually a picture of one of the interior of one of the cabins at our shelter program that we call 33 Goff or Goff cabins. And then we also have semi-congregate shelters that have smaller shared rooms in comparison to the congregate sort of larger dorm spaces. And then in addition to emergency shelter, we also have transitional housing programs that are sort of in between shelter and housing. People can stay there for longer periods of time and receive more intensive services to help them reduce their barriers to housing and connect to the right housing service for them. Okay. Just really put this on here if folks want to link to our public dashboard. We do have a dashboard available on our HSH website that updates every day. You can really to understand what our full shelter inventory is, how many folks are staying in our shelters, what our capacity is in the various types of programs. And then wanted to quickly mention something about accessing shelter. Again, this is all on our website, but one of our main entries for adult shelter is by calling SF Hot to join the adult shelter waitlist. There's also some walk-in shelter services available at the Dolores Adult Shelter in the Mission. And then we do have a few shelters that work with community partners on referrals. So some of those community organizations that, for example, work with the trans community have direct access to making referrals to the Taman Bhutan Navigation Center, which is a shelter that we fund that provides services to the trans population, trans-identified folks experiencing homelessness. For families, our shelter goes through our coordinated entry access points, but we do have a program that allows self-referrals. It's at a San Francisco Unified School District school called Downtown High School, and families who have children in the school district can access shelter there by walking in. It's an overnight only shelter during the weekdays when school's in session, and then on weekends and throughout the summer, it's 24/7. And then for youth, shelter is really accessed through the coordinated entry access point. And youth are also allowed to access the adult shelter system, including the Dolores Adult Shelter that is a walk-in or accepts self-referrals at that shelter. Okay, I wanted to talk a little bit about housing. We also have permanent housing solutions for homelessness. We have a variety of different types of what we consider permanent housing, or what we categorize our housing services under. So we have one category is permanent supportive housing, which includes site-based PSH or permanent supportive housing, where we have buildings across the city where the entire buildings are dedicated to this permanent supportive housing service. And as you can see, we have over 9,000 units in our system. There's also some scattered site programs where we have tenants are using rental subsidies essentially to live in private market units that are funded through this PSH rental subsidy. And also just to mention in PSH that tenants pay up to 30% of their income. And our permanent supportive housing sites also have voluntary support services, either through like a roving case management or through on-site services if it's a site-based program. In addition to those services, to the case management services, we also partner with DPH and with HSA or with DOS to have other services provided on site. So we have some programs with physical and behavioral health services on site, or IHSS services for older adults and people with disabilities. Okay, next slide. Other parts of our housing system, we have rapid rehousing, which is really a time-limited rental assistance program, and then a housing ladder program, which is an ongoing subsidy for former residents of PSH to move into into more independent site-based or scattered site units. Okay. I put a little bit in here about accessing housing. Really for HSH housing, all of that housing is accessed through our coordinated entry access points. So really important to have folks go there as the front door of the system for how, if they're interested in housing with HSH. And then a few other resources just put on here about other housing in our system. Okay, so I wanted to jump to our meal services. I know that's one of the things that's probably most interesting for this group. HSH is funding meal services at some of our programs, and I'm going to walk through these. Really, most of it is occurring at our shelter programs. So that'll be my big focus. Okay, so the bulk of meals provided through HSH funding is at our HSH shelter programs. We have some meal standards of how we're providing meals at shelters. So for our family emergency shelter programs, we typically provide 3 meals per day for families. There are a few exceptions to this, which I'll talk about later, but our general standard is 3 meals a day at family shelter. And for adult and youth shelters, that's 2 meals a day. Our providers also provide snacks or additional food for special events or coffee or other things to have at the program available to guests. And then we do have, I just wanted to mention that we do have some scattered site hotel voucher programs that we don't have regular meal service at. Primarily, these are scattered site throughout the city. So some of those programs are able to provide some grocery vouchers for folks who are in need of those programs. Also, the meal provider that's going to provide the meal services at our shelters really depends on the type of facility that the shelter is and what they can accommodate. It basically based on their layout or their ability to cook meals at their site. So generally, if a shelter program has a kitchen, like an industrial kitchen at their facility where they can cook meals, then the nonprofit that operates that shelter will generally cook the meals in-house. That's really our preferred scenario when that's possible. And when there's no kitchen at a facility, then HSH, some things could happen. The main thing is often what happens is that HSH will provide meals through our meal vendor, which is Meals on Wheels. They can provide hot or frozen meals depending on the facility and what they can accommodate. In some cases, HSH doesn't use our vendor if the nonprofit prefers to subcontract with their own meal provider. There's a variety of reasons why that might happen. For example, we have a shelter, ECS operates a shelter that they use their own meal vendor because it includes also like a vocational rehab component to that meal vendor, and it's in-house with that nonprofit. So we do have a number of programs that subcontract their own meal vendor instead of Meals on Wheels. And then again, there's some programs that don't have a meal service. Often this is occurring because they have a kitchen or kitchenette available to guests. And so instead they may provide some meals, but then they also provide grocery vouchers or gift cards for guests who are wanting to prepare their own meals. And then a lot of our shelters do use food donations as well from the community. Okay. For our shelter programs, we have quite a bit of oversight in our shelter programs for the meals that we're providing. And this is really through a strong partnership with the Department of Public Health. There's a dedicated staff person who's a registered dietitian who works on the shelter health team. And they work with the shelter team at HSH and partner with all of the shelters to providing their food service. So they really just provide the oversight to ensure that each of the shelters are providing appropriate and adequate food service. We also have what's there's some legislation in San Francisco called the San Francisco Shelter Standards of Care that has a number of standards that are specifically about food service. And that is really what is outlined, the requirement for all of our shelters to work with a nutritionist to advise on their meal plans and ensure that, you know, folks are meeting the requirements of the standards of care. Okay, the next slide really talks about the dietitian's role. So the registered dietitian provides oversight and training. This applies to both food cooked at the shelter site and food that is potentially brought in through a meal delivery service or even food donations that people receive. And really, in summary, the registered dietitian is providing quarterly on-site visits to every shelter, doing professional consultation for them around their menus, staffing, equipment, a variety of things. They're reviewing their menus on a regular basis to ensure that it meets the nutrition requirements that they've established. They also investigate complaints. They provide food handling training to all of our sites, and they do annual evaluations of each shelter. Okay. I wanted to highlight a little bit about the HSH meal service provider, Meals on Wheels, because they do serve a lot of food within our shelter system. They currently are serving to 16 of our shelter programs. These are mostly adult programs and mostly navigation centers. This meal vendor, Meals on Wheels, can provide either frozen or hot meals. And really this partnership with Meals on Wheels began with in navigation centers when we wanted to really embrace a low threshold model in the navigation centers, or a low barrier model. So we have things that exist like no curfew, limited rules. We allow for pets, partners, and possessions. And we also wanted to have expanded hours for people to access meals. And so really effectively a meals on demand model where someone could come in the middle of, late in the evening. If they missed mealtime, they would be able to get access to a meal at many different hours of the day, almost 24/7. And so employing frozen meals really helped us be able to do that, to try to have this meals on demand model. Okay, and next slide, I just wanted to highlight, I'm not going to go through each one of these, but these are some of the requirements we have for the Meals on Wheels contract. And you can see in number 3 a little bit about what some of the requirements are for our menu pattern around, certain amounts of protein, fruits and vegetables, grains, or starchy vegetables, and milk. And then just really what specifics need to be required around the nutrient analysis, special meals that are able to be served. So that really helps outline what some of their requirements are. And then lastly, I wanted to just highlight quickly about other food supports at HSH programs. I know I spent a bit of time talking about shelter, but we do also think a bit about food security at our other programs. In housing, we have housing tenants in HSH funded programs. They tend to mostly utilize community resources like food banks and home delivered meals. But our case managers really do try to help assist tenants in accessing those meals. I know quite a number of PSH residents in particular use Meals on Wheels and Project Open Hand for home delivered meals. We also, some of our housing programs do work with local food vendors and restaurants. For example, one program has like a refrigerated vending machine that vends free meals to residents or tenants at the program. Also on outreach, our San Francisco Homeless Outreach does really consider food, mostly snacks, food and water, though, to be an engagement tool when they're out on outreach and engaging with folks. Their case managers and outreach workers also provide community resource information to folks when they're working with them out on the street. And then I also wanted to mention we do have a site, the Bayview Drop-In, which many people know as Mother Brown's, in the Bayview, that provides quite a lot of meals every day to the community in the Bayview Hunters Point area for people experiencing homelessness. And then I know you'll all have access to these slides. I included a number of links here to things I referenced in the presentation. So just, yeah, that's it. And wanted to say thank you and can take any questions.
Fabulous. Thank you so much. That's really great. Really appreciate the in-depth. I mean, it's so impressive. If anyone hasn't seen the Navigation Center interventions, they're really smart interventions for folks to be able to access food at different hours and different ways. So, and also these food vending machines, pretty awesome. So love the traditional approach with shelters, love the unique approach. So really, thank you for that overview and really understanding that food system. We're gonna open it up for Chester, who's got a question.
Yes, thank you. Thank you for the overview. That's excellent. I'm a bit familiar with some of your programs, having worked in the past. But I have a concern, given the history of homelessness in San Francisco, I want to say this, at kind of a two-part question. Does it continue to increase in the city? And if it doesn't, what type of individuals are still coming into San Francisco that from different parts of the country? I don't know if you're able to trace that, but I've always wondered, I understand why they come because of what the PR and the propaganda that's been thrown at San Francisco over the years, being a native. Because we never used to have that much homelessness. We always had it, but never at the levels that we've had it, say, in the last 15, 20 years. And my concern is, where are they coming from? What areas of the country seem to be more particular to coming into this particular program? If you can answer that.
Chester, I really appreciate your question. I think that's a very smart question. I don't know that I can answer that right on the spot. I think I'd have to kind of go back to our data team. And a lot of that is, a lot of it's anecdotal as well. Some of the information that we're getting when we're working with individuals, when they, sort of tell us where they're coming from. Our point in time count, unfortunately, we're not necessarily engaging with folks individually. It's really a visual count. We do some surveys. And so, yeah, I can certainly try to get some more information for you. I don't know, Marion, I know you're also on the call. I don't want to put you on the spot. I don't know if you have any thoughts on this question.
So many thoughts. I was actually pulling up our point in time count. Chester, I would defer you there, but I mean, by and large, there's more people falling into homelessness locally than there are people coming into the city from other parts of the country. So we have an inflow problem. And so, traditional things like economic reasons, people losing their jobs, domestic violence, like those type of reasons are causing folks to fall into homelessness. We did see an uptick of migrants coming into San Francisco, but again, proportionally, that's not, the biggest kind of influx into the city. We do have folks coming in regionally. So those are some of the things. But when, I think it's not, it's a rumor more so than anything that there are a ton of people coming from other states into San Francisco. And I think that's by and large, something that is believed, but that there's no data that backs that that to be true. And so I hope that answered your question.
It did. It did. Yeah,
Mhm.
because it's one of the thank you for your response, because so often what I hear on my end is we're being invaded. Okay. And sometimes you say, yeah, but I'm not sure. You know, it doesn't necessarily seem that way, but you gave me actually what I asked for. Thank you very much, ladies.
And that's just off the cuff. I need to. I was pulling our.
I'm not holding you to
Pick
it.
count
I
information
understand,
really
you know.
quick,
We
but
won't hold you to it, man.
Yeah, because data is
off the
data,
cuff,
you know.
yeah.
But the reality is you kind of get a concept of where is this coming from, why, not so much why it's happening, because that's a psychological thing. But generally, to a lot of people, and I'm saying this because the people I'm talking to are older, established citizens in San Francisco. So you see where that's coming from. They're feeling invasion. And of course, you're saying, no, that's not true. You know, there's other factors that are there. So that was a good response. Thank you.
Yeah, it's not yeah. I mean, you know, yeah. I'll leave my statement there.
Katie.
Yeah, I was curious, and you may have shared this in the data and I missed it, but do you have information around, like, if someone is a more chronically without housing, or if there are like shorter stints of people being unhoused, or do you kind of know what the makeup of that is in the city? And then is it really, I mean, I won't ask the question of like what's the root cause, because I'm sure you both are like there's way too many to even talk about. But is it really like a resource thing? Like there's just not enough units, and that's kind of, yeah.
I mean, affordability is the largest. So to solve homelessness, you need housing, period. So we don't have enough housing. It really is that basic. And obviously, Lisa lifted up like all of the systemic racism, which is very compounded. And you got the economic drivers, you got the health drivers, all of those things. But by and large, we don't have enough housing, enough affordable housing. So affordability is really the largest issue.
Great. I have a question for y'all, because one of the things that the Food Security Task Force has recommended in the past years is to look at food programs for residents of supportive and affordable housing. And the thought here was that this, really looking at trying to stabilize folks in their housing so that they don't become homeless, right? Which is, I think, one of your goals that you're talking about, the prevention. Can you tell us maybe the way to approach this is, do you see gaps for food and people that are unsheltered, and the need to where gaps we might fit together? And then is that recommendation, how do you feel about those food supports for stabilization? This is a two-part question.
Can you state your question one more time?
Sure. Are there gaps that you see in the food system for people that are either unhoused or are recently housed and needing food support? That's my first question. And the second question.
Do you want to take that question first, Lisa?
Yeah, I mean, one of my key areas that I oversee is outreach and shelter. And so I think one of the, we do see on outreach folks who are, dealing with food insecurity. It's something that they talk to their outreach workers about, so for a variety of like health reasons or other reasons. Sometimes it's difficult for folks to go somewhere to get food. There are some resources in the city, of course, that, they're providing food for folks who are unsheltered. But they're not necessarily everywhere in every community around the city, and it sometimes can be difficult for some folks to access those. Yeah, I mean, it's definitely something that we're seeing on outreach. I'm not sure.
Yeah,
What was the second part of your
so
question?
basically I'm hearing that food security is especially when you're outreaching folks, it's difficult for a lot of folks to access food depending on where they are. It's depending on their
and depending
circumstance
on
and where they are.
other health needs, we have a lot of folks with behavioral health issues, medical issues that makes access just that much more challenging. And the outreach workers are doing what they can to try to connect people and support them to get the resources they need. But there's only so many outreach workers and just a lot of folks who are unsheltered and do have those needs.
And I think, even to extend that, you see it all throughout our system of care, even for folks that are housed, folks that are in PSH, have food insecurity issues as well. So you do see it throughout the system in various shapes and forms.
Great. Thank you. Yeah, and that was the second part of the question, which is the recommendation to ensure that there's food supports for those particularly, recently housed. Because if you're in a shelter, you actually have food access, but then you move into housing by yourself and then you lose that food access. So ensuring there's food access to stabilize, particularly those getting housing. Just wondering if you feel that that's still a need, or is that something that you feel is taken care of?
Oh no, it's still a need.
Okay, thank you.
Yeah, for sure. For sure. It definitely is still a need.
Yeah, and I would just add, some of the housing programs, they do have case managers and they do have some flexible ability to, at times when folks are dealing with food insecurity emergencies, to potentially, supplement with a gift card or grocery voucher. They do have those types of resources, but it's not at the level that, if someone's having ongoing food insecurity issues, that's more challenging. That it's really meant to try to sub in for a period of time to really help that person then get connected with community resources.
Thank you.
Yeah. If I could go back to, was it Chester's question really quickly? Not to belabor, but I was pulling up the data, so I wouldn't be talking off the cuff. But from our point in time count last year, before they became homeless, 59% of folks were housed in San Francisco, 30% other places in California, and only 11% were out of state. So you see proportionally, most folks are becoming homeless and are from here. And there was another question related to chronicity that I just wanted to pull up really quickly. Or having a disabling condition. So chronicity, the definition of chronically homeless is basically a prolonged or multiple episodes of homelessness and having a disabling condition. And so about 42% of folks that were surveyed express having a disabling condition, meaning, some type of chronic illness. And I think that was, Katie's question. And then overall population, we've seen just a decrease and then a slight increase from 2019 to 2024. But there's around 2,930 folks of the little bit more than 8,300 folks that are chronically homeless from the 2024 pay count. So I just wanted to make sure to kind of round out the responses.
Yeah, thank you. Super. I want to open up to other questions. Thank you guys for being so thorough on this. Really appreciate it. Okay, I'm not seeing any hands up. I'm not seeing any notes. I'm gonna open up for public comment. Okay, I'm not seeing any hands up. I'm not seeing any notes in the chat. So thank you guys again. I think this is really, really helpful to get the full information, and then that linkage between housing and food and how important that is. So we're happy to, I'm sure this will spark more discussion. So thank you guys both. And again, Marion, we're really happy to have you on board. And Lisa, thank you so much for that presentation. Super.
Thank you. Thank you, Lisa.
Okay, we're moving on to item number 8, which is the status of the Food Security Task Force and next steps. So for those of you, there's a lot happening around this issue. So there's really 3 big updates, 3 big sections that I want to update you on. One is the task force on committees, and that's that group that was making recommendations for the committees and task force across the city, and they did have their public hearing on October 15th. Many of us were there, represented. Many of us were very frustrated that the meeting went on so long and wasn't tabled for another day. It started at 1 p.m. We were not heard until about 9:30, 9:50, 9:30 at night. And unfortunately, some folks that were going to give public comment just couldn't manage to stick around that long. What the task force recommended was to eliminate the Food Security Task Force. They did not have a lot of discussion on this issue, which was also disappointing. The one piece of conversation that I think was said is that staff can handle this issue or can handle those activities. And that was it. Again, it was like the end of a very long day and a very long meeting. I know Katie was present. Katie was there. If there's anything you want to add to that.
No, I think you summed it up, Sissy.
Yeah, I didn't feel it was. I felt for a task force that has met all of the requirements for being a successful task force and for having recommendations every year or 20 years and being very impactful, we thought this was dismissive of the work of the committee. So and felt like maybe it was already a done deal, but again, highly disappointed in the process that didn't allow public comment, or that created, that was just very difficult for people to be able to give public comment. So again, we're disappointed with that. However, that is a recommendation to eliminate the Food Security Task Force. We also know that the task force is slated to be. We are slated to sunset in July of this year. We also know that we have been talking to many of the supervisors and around the. We also know that we would like a better system than the Food Security Task Force, and we've been asking for this for a couple of years, and that's the centralized food coordination with a community advisory board. We have some good news. We've gotten feedback from a number of supervisors. They are there is very much interest in reauthorizing the task force past July of 2025. But even more exciting is that we do have a supervisor that has shown strong interest in supporting legislation for the centralized food coordination with a community advisory board. So that's really the system that we have been recommending, that we would prefer than the Food Security Task Force. So that's very good news. that leaves us a couple of decisions. So there's a couple of next steps for this, but there's a group of us that have been meeting with the supervisors. Again, we met with Chen, Fielder, P, help me out with them, Mahmoud,
And Walton.
And then we have a couple other supervisors coming in. We also spoke with some other stakeholders around their feedback for what they thought was feasible for this activity. So that leaves us, it's kind of an interesting situation. In one sense, you're like, eliminate the task force, sunset it, and create something new that we want better. So we have a couple different tactics that we can do. The next steps for the supervisor, again, we won't say who that supervisor is until they're confirmed that they're willing to do that legislation, but is to give them some overview of what the legislation would look like, and the community advisory board, and then work with that supervisor in terms of the legislation and see who else of these other supervisors would be on board. Does anyone else want to give some feedback on those meetings with the supervisors? Because I think they were very interesting. I know Katie was in some food bank.
Yeah. Oh, I said Chester has his hand up.
Go ahead.
Sissy, are the supervisors willing to support us financially? I mean, in terms of getting this program off the ground, that's going to really be important. Because I have to say, been in the organization as long as I have, and all of the work that has been done through Paula and a number of other people in this organization, they should never have considered this. They should have offered us another option early on in the game, because there was a lot of work. I still have full publications that we put out, excellent publications. I had other people from other counties look at it and say, wow, you guys did this, And so I'm glad that they're doing what they're doing, but I think they need to support us financially. So is there any wind to that, or is it possibility in negotiations? I'm just throwing it out. Thank you.
Yeah, it is super interesting. Of all the task force, financially, it's so little. I think it was only like 63K or something per year. I mean, it's really a tiny bit of money because a lot of the work was done by the volunteers. But it is a question that was actually brought up by one of the supervisors around the for the new structure. And could there be, knowing that Mayor Lurie really appreciates public-private partnerships, is exactly what happened with the card situation with SNAP. So is there a possibility of looking at some public-private funding for food coordination? I think is a great idea, and might help make this proposal more appealing.
Thank you.
The other thing that came up in those meetings was just talking about the efficiencies that are created through working as a council and having, folks on the same page and being able to leverage the city and community relationship through the council. So that was something that was brought up. But I think overall I think a lot of interest, a lot of support from all the offices that we had spoken to. And then the recommendation to talk with the entire board. We had started with some that we had thought would be more interested. And so I think that's P has been setting up those meetings for all the board members to bring the issue.
I think the other thing that's really important to mention for everyone is that all of the supervisors and the staff that we met with were talked about the importance of getting stories out there about the communities getting together and talking about how important food security is, so it doesn't become a lost issue. And I think that was a really important part of the emphasizing the importance of community getting together, and because food security is such a big issue. So that was definitely that was a theme from a number of stakeholders. And they felt that this mayor was particularly interested in hearing from the community. So lots of different things happening all kind of at once, but the next steps that we are looking at are we need some volunteers to help. There's a smaller group that comprises of that has been working with the supervisors and around this food coordination, and we would love to see some more volunteers if you're interested in helping, because the next steps are to actually look at the ordinance, the outline of what this proposal would look like. So this small group would come in, and then we would come back to the task force and run this by the task force for feedback. And also through the supervisor that's willing to sponsor this legislation. So if anyone is interested, I'd love to hear that. Again, we will some of the nuances of this is around what does that community advisory body look like? It'll need to follow the new advisory structure given from this task force on committees. And then there'll need to be seats and representing different community members. So we'll need to discuss some of that. And again, there'll be more discussion on this and specifically what the role of that advisory body is. And then clarifying this the centralized coordination of food security. Now a lot of that framework is already developed. So I think that's from the past ordinance that was, it's just the big issue, not having public meetings in the community board. So that's the next step. If anyone's interested, the group is Katie, myself, Jade from FACTS, folks from the food bank. So anyone else welcome, please let us know. But I think this is good news because again, we want to be focused really on what the problem is. The problem is that we need regular coordination around food security in San Francisco, as evidenced by what's happening right now, right? And it cannot happen alone. It has to be this effort, and there has to be community involved. And so we really just want to create a structure that makes this as easy and as helpful as possible. So we're hoping this new structure, regardless of sort of what's happening around these other task force, will be what we need for the future. But I 100% agree, Chester, with I thought it was I thought the task force was very dismissive of it wasn't representative of the good work of this committee. Questions on this, comments, questions, want to hear from you. Okay. Great. Then this next steps are this smaller group. And again, anyone who wants to help with that, let us know. We'll then prepare some initial information to bring back to the task force. Great. And then there is a discussion point, but we'll do this next meeting around whether we need to, again, we have support from a number of at least it was like four or five. I can't remember how many supervisors were willing to reauthorize the task force. So again, there was a big need, felt that it was important. So there is plan A is to get this, what we really want, the food coordination with the advisory board. Plan B, depending on that time frame, is we could extend the food security task force, knowing that it would, end once this new group comes up. But if we don't need to do that, we don't need to do it. And then part C is the task force that recommended task force is that process goes a long process ending in a vote in November of 2026. So that process kind of doesn't happen for a while anyway. Is that all making sense? Clear? Okay, good. Sorry, there's a couple different elements there, so I appreciate it. Any other questions on this before any public comment? Oh, Beth said, I'm interested if it can be outside task force. Yes. Great, Beth, we got you. Okay, good. All right, public comment. Not seeing any hands. Okay, we are good. All right, so want to move out to the next item, which is updates and emerging issues. God, we have a lot of emerging issues we've already discussed. I hopefully there's no other emerging issues. What do we got? What are the updates we have? I know everyone gave updates on our current emergency situation. Do we have other updates?
We have an open house this week, at Project Open Hand. It is tomorrow, Thursday. Right. And let me drop the flyer. So I'll drop the flyer in the chat, but this is really audience intended as our clients, providers, members of the community. We'd love to have you drop by and visit us. Okay. It's at 7:30 Polk, but I'll put the flyer in the chat.
Great, thank you. Other updates, Noriko.
Yeah, I just wanted to flag for everyone that the USDA just published a notice for proposed rulemaking to update the staple food stocking standards for SNAP. And so the proposed rule is for SNAP retailers to stock for a greater variety of staple foods and perishable items. And so I feel like that is going to vastly impact a lot of our neighborhoods, especially the Tenderloin, where they don't have access to a wide variety of grocery stores. So it's just something to flag, especially for that subgroup that's working specifically for the Tenderloin.
Yeah, thank you. That's actually, yes. Thank you, Noriko. What is the timeline on that again? Sorry.
Oh yeah, no worries. Let me just bring it up real quick. I believe people have until November 24th to submit comments. So I'll just drop the link into the chat of where people can submit their comments.
Great, thank you. Okay. Preeti.
Hi.
Oh. I think your connection might be unstable. Oh no, Preeti was going to give an update on WIC. Are you there, Preeti?
She'll be back.
Yeah, we'll give her a minute. Yep. Other updates while we're waiting on Preeti. Oh, there she is.
Hi, can you hear me? I don't know what happened.
Yeah, we can hear you. Yeah.
Sorry about that. Now, just a quick update on WIC. We are going to continue to stay funded through the end of December. We got news from USDA that there will be $450 million pushed out to the WIC program nationwide, and so that should help us take us through the end of December. So it's good that we continue to stay funded. We're still pushing out a lot of messaging around CalFresh benefits and sharing out all the resources that the CalFresh and Susie Smith and her team has been sharing. But we're glad to be at least open until December, just hoping for the shutdown to end and things to resume back. But that's the status on WIC. Thank you.
Great. Thank you, Preeti. Thank you for keeping us updated on that. It's also helpful for everyone to know, because people have questions about CalFresh and they need to know that WIC at this point is not impacted, right? So thank you. Any other updates?
Hey, Sissy, it's Jennifer. I think I shared this, but we have been notified by both California Department of Social Services, who handles our child and adult care food program, and by California Department of Education, who handles our National School Lunch Program, School Breakfast Program, that they have received funding through November for both those programs. So we haven't heard anything about December yet, but October and November, we're good.
Okay, good. Thank you.
Yeah, you're welcome.
Beth.
Thank you. This is a little bit more. SFE welcomed C40 cities. We hosted a food waste and procurement workshop a couple weeks ago. It was neat to have a bunch of different cities come, and one of our biggest takeaways was the prioritization of food in our general city. Just having an office of food or centralized food. And the topic came up about including food priorities in the climate action plan. So I just wanted to put this on everyone's mind if there's ways that food procurement and waste policies could fall under the climate action plan. It's something that we're thinking about moving forward.
Great, thank you.
And that's the city's climate action plan, not just our environment.
Great. Okay. I'm not seeing any other comments before we wrap up today. Okay, I am not seeing any comments, any public comment, any public, not seeing any hands. And I'm not seeing anything in chat. So thank you all so much. I know we're all out there doing double time trying to meet this crazy need. We're all hoping that all of these resources will get reinstated in full because there's already so much work around the holidays anyway, just getting folks their regular needs. Chester.
Let me say we should all celebrate on the election and the results of the election. It threw out a great statement. Hopefully it will continue into next year's midterms. I had the privilege of having to work on the election, and it was fantastic. The outpour was just great. And some people disagreed with me, but I said, I think we got it, and we got it. So the reality is, if this is what we need to do to make things better, if we need to continue to work with the Food Security Task Force to get what we need for people, then that's what we have to do. And I want to thank all of you for being a part of that. Thank you.
Thank you. Great. On that note, the very positive note, we will head out. And again, thank you all for all your work. Special thanks to HSA and all of the nonsense that you all are going through and all that extra work. So J-Mill and Fiona, for all of you and your team, thank you again so much. And for everyone that's been stepping up. So
thank you for
and
the
Jennifer and
collaboration, everyone.
Yeah.
All right.
Thanks, everybody.